If you've been hearing about Xiaflex and wondering what it's all about, you're in the right place. Xiaflex has been making waves as a treatment for two challenging conditions, Dupuytren's contracture and Peyronie's disease. It's a non-surgical solution that can help improve quality of life for people dealing with stiffness in their hands or painful curvature of the penis. While Xiaflex might sound complicated, we're here to break it down in a way that's simple, clear, and most importantly, useful. Number 1. What Xiaflex is and what it treats. Xiaflex is an injectable medication specifically designed to treat Dupuytren's contracture and Peyronie's disease. These two conditions may seem unrelated, but they share one important thing in common. Both involved in the buildup of collagen plaques in the body. In Dupuytren's contracture, these plaques form under the skin of the hand, creating thick cords that cause the fingers to bend and lose mobility. On the other hand, no pun intended, Peyronie's disease involves scar tissue that causes curvature and pain in the penis, especially during erections. What makes Xiaflex so unique is its ability to target and break down these collagen buildups without requiring surgery. It's a game changer for those who want a less invasive option to address these frustrating and sometimes debilitating conditions. If you've been struggling with either issue, Xiaflex might just be the solution you've been looking for. Number 2. How Xiaflex works. Xiaflex works by using a special enzyme to break down collagen, the protein that forms those tough plaques. Think of collagen as the glue that holds the plaques together. Xiaflex essentially dissolves the glue, allowing the tissue to loosen and regain flexibility. This process is incredibly precise, which is why the treatment is administered directly into the affected area by a trained healthcare provider. For Dupuytren's contracture, the injection weakens the collagen cord, allowing your doctor to gently stretch or straighten your finger in a follow-up visit. With Peyronie's disease, Xiaflex targets the scar tissue in the penis, and patients are asked to do gentle stretching exercises to help straighten things out over time. It's a fascinating use of science to solve a very specific problem, and for many patients, it can feel like a miracle. Number 3. How it's given. Xiaflex isn't a medication you pick up at your local pharmacy. It's an injection that must be given in a clinical setting by a qualified healthcare professional. For Dupuytren's contracture, the process typically involves a series of injections into the collagen cord, followed by a separate appointment where your doctor gently manipulates the finger to break up the cord and improve movement. Don't worry, it's a straightforward process, and you'll be guided through every step. If you're being treated for Peyronie's disease, the process is slightly different. Xiaflex is injected directly into the scar tissue that causes the curve, and you'll receive a second injection within the same treatment cycle. Your doctor will show you how to do simple stretching and straightening exercises at home to aid recovery. It might sound a bit intimidating, but rest assured that healthcare providers are experienced at making the process as smooth and comfortable as possible. Number 4. Key benefits of Xiaflex. One of the biggest draws of Xiaflex is that it offers a non-surgical treatment option for two conditions that previously required invasive procedures. For people with Dupuytren's contracture, Xiaflex can slightly improve finger movement without the need for lengthy surgery or downtime. Similarly, men with Peyronie's disease can experience a noticeable reduction in curvature, improving comfortable and restoring confidence without the risk of surgery. Another key benefit is the shorter recovery time. Compared to surgery, Xiaflex allows most patients to resume their normal activities much faster. Plus, since the treatment is targeted and minimally invasive, the overall impact on your body is less traumatic. For many patients, this makes Xiaflex an easy choice when weighing their treatment options. Number 5. Common side effects. Like any medical treatment, Xiaflex comes with some potential side effects. For Dupuytren's contracture, the most common issues include swelling, bruising, and pain at the injection site. You might also experience itching, warmth, or tenderness in the hand. While these side effects might sound unpleasant, they're generally mild and temporary, resolving as your hand begins to heal. For Peyronie's disease, side effects are a bit more specific. Some men report swelling, bruising, and tenderness in the penis, as well as small blood collection under the skin or hematomas. Painful erections and slight changes in skin color are also possible. While this may sound boring, your doctor will monitor your progress closely to ensure you're recovering safely and effectively. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Serious risks to be aware of. While serious side effects are rare, it's important to know about them. For Dupuytren's contracture, there's a small risk of tendon rupture or ligament damage if the injection affects nearby tissues. If you find you're still unable to bend or use your finger after treatment, contact your doctor immediately. For men with Peyronie's disease, a severe but rare risk in penile fracture, which can occur during an erection if the inner tissue is weakened. Symptoms include a popping sound, severe pain, and swelling. This is considered a medical emergency and may require surgery. So it's essential to follow your doctor's guidelines closely during treatment and recovery. Number 7. Who should avoid Xiaflex? Not everyone is a candidate for Xiaflex. If you're allergic to any of its ingredients, including collagenase Clostridium histolyticum, this treatment isn't for you. Your doctor can discuss alternative treatments if you have a history of severe allergies. For men with Peyronie's disease, Xiaflex isn't recommended if the plaque involves the urethra, the tube you pee out of, because of potential complications. It's always a good idea to discuss your full medical history and any existing conditions with your healthcare provider before starting treatment. Number 8. What to expect after treatment. After receiving Xiaflex, recovery is all about patience and follow-through. For Dupuytren's contracture, you'll likely wear a splint to keep your fingers straight and need to perform daily finger exercises to maintain your progress. These exercises are simple and quick, but crucial for regaining full mobility. For Peyronie's disease, your doctor will show you how to do gentle stretching exercises to help strengthen the penis. You'll also need to avoid sexual activity between the first and second injections and for at least 4 weeks after the treatment cycle. While recovery takes time, many patients see noticeable improvements within weeks or months. Number 9. How effective is Xiaflex? Xiaflex has proven to be highly effective in clinical studies. For Dupuytren's contracture, many patients regain significant finger motion, making everyday activities like gripping objects or shaking hands much easier. For Peyronie's disease, studies have shown that Xiaflex can reduce curvature by an average of 35% to 45%, a significant improvement for most men. It's important to set realistic expectations though. While Xiaflex isn't a miracle cure, it offers meaningful improvements that can greatly enhance your quality of life. Discuss your goals with your doctor to ensure that treatment aligns with what you hope to achieve. Number 10. Cost and insurance considerations. The cost of Xiaflex can vary depending on factors like insurance coverage and location. Since it's a specialty treatment, it can be pricey without insurance. However, many insurance plans cover Xiaflex, especially when it's medically necessary for Dupuytren's or Peyronie's disease. If cost is a concern, don't hesitate to talk to your healthcare provider. Many offices offer payment plans or resources to help patients navigate insurance approvals. The manufacturer also provides assistance programs that can help lower out-of-pocket costs, so you can access the treatment you need. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!